Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dale Amanda Tyler. Dr. Dale Amanda Tyler was born in Montreal, Canada, and she resided there until completing medical school at the world-renowned School of Medicine at McGill University in 2002. She was then accepted into a general surgery internship and otolaryngology head and neck surgery residency at the University of Florida in Gainesville. She then elected to pursue further specialized fellowship training in pediatric otolaryngology head and neck surgery at Rady Children's Hospital in San Diego. She is currently board certified in otolaryngology head and neck surgery, both in the United States and Canada. Dr. Tyler currently practices medicine at Washington Township Medical Foundation in Fremont.
Hearing loss is something that's common. I'm sure everyone in this room is in some way affected by hearing loss. If not you, then a loved one. And there's a lot of information that people don't know or understand about hearing loss. And there are a lot of options for therapy of hearing loss that you may not know about. And so what I want to present to you today is what exactly the impact of hearing loss is on you and on loved ones if you are a person who has hearing loss, and what are some options that are available today. And we're lucky enough to have Dr. Ken Smith. He's an audiologist here in Fremont and in Castro Valley, and he'll be speaking as well as to some of the options for treatment of hearing loss. So if you do have the handout, on the first page is a questionnaire. And it is a bunch of questions that I'm going to just put up here, and we don't have to necessarily go through every single one. But as I'm mentioning them or at this time, go ahead and see if any of these fit you or someone you love. And if there's more than a few that are a yes, then there's a very good chance hearing loss is coming into play in your life. So questions such as, do you have difficulty hearing over the telephone? Do you hear better through one ear than the other when you're on the phone? Do you have trouble following conversations when two or more people are speaking at the same time? Do people complain that the TV is just too loud? Do you have to strain to understand conversations? Is it tiring to understand conversations? Is it difficult for you to hear when there's a lot of background noise? Do you have trouble when you're in a restaurant hearing what other people at your table are saying? Do you have trouble with dizziness, pain, or ringing in your ears? Are you finding yourself having to ask others to repeat themselves when they say things? Do family members or coworkers complain that you're just missing things? And does it seem to you that people around you are mumbling or not speaking clearly when they say that they are? Finally, do you misunderstand what people are saying? Do you sometimes answer completely incorrectly to something you would know the answer to if you heard it properly? Do you have trouble understanding particularly the speech of women or of your grandchildren or other children in your life? Do people get annoyed because you misunderstand what you're saying? I'm sure a lot of these apply to people in this room, and they are indications of some degree of hearing loss. So with respect to disclosures, I don't have any financial disclosures to declare to any of you today. And we will be talking about some technologies and some surgeries that involve certain devices. There are a number of devices and a number of surgeries out there, and I'm mentioning some today, but I don't have any preference of one company over another company, and I just want to provide to you an overview and not steer you to any one direction. So, the ear. It's actually a pretty complex little thing, and some of the terminology I think can be pretty confusing for people when it comes to understanding your ear. But to try to simplify it, the ear is divided into three parts: the outer ear, the middle ear, and the inner ear. The outer ear is comprised of the part that you sort of see out here, we call it the pinna, your ear canal, where wax is produced, and all the way down to your eardrum. The middle ear space goes from the eardrum, and it includes your hearing bones. There's three of these hearing bones. They're the smallest bones in the body. They call them the malleus, the incus, and the stapes, or some people call it the hammer, the anvil, and the stirrups. And they end at the junction with the inner ear. And the inner ear is entirely surrounded by bone, and it involves two parts: the hearing portion, called the cochlea, and the balance portion, which involves the balance canals and some other structures. And from there, from the ear, you have a hearing nerve that goes off to the brain. I have a little animation that sort of shows how it works. So sound comes in from the outside, down your ear canal, and it vibrates your eardrum. This moves these three hearing bones, and on the third hearing bone here, called the stapes, there's a membrane that goes to the inner ear, and down into the cochlea the sound is traveling. So again, now you're seeing the sound traveling down. It's going to vibrate the eardrum, it's going to vibrate the hearing bones, and push into the inner ear. Now, there are tiny little hair cells that are little nerves. There's 20,000 of them that go all throughout the different parts of the cochlea, and the sound vibrates at a very specific part of the cochlea. So if it's a very high-pitched sound, for example, it'll vibrate in this portion of the cochlea. And if it's a very low-pitched sound, it vibrates all the way down here. So those various nerves then send information to the brain via the hearing nerve, and the brain can tell what it is and can interpret what it is that you're hearing. When you have hearing loss in any of these particular areas, when you have a problem in any of these areas, you can develop hearing loss. And by and large, there are three types of hearing loss. There's a conductive hearing loss that many of you have experienced along the way. That's a block anywhere of the outer ear and the middle ear. Say, for example, you have wax plugging off your ears. Everyone sort of experienced a moment when the wax might have plugged you off, and having that wax removed suddenly allows you to hear again. Well, that's just blocking the sound vibrations from going into your eardrum and beyond. If you have an ear infection, fluid tends to fill this middle ear space, and that can block some of the sound vibrations from getting to your inner ear. If you've had a problem where you develop a hole in your eardrum, the vibrations don't work properly. So this all leads to what's called a conductive hearing loss. Finally, there's a process that's called otosclerosis that is relatively common, where that third hearing bone becomes fused and it isn't able to kind of push the vibration deeper into the inner ear. And so there's many reasons why a person could have a conductive hearing loss, but for the most part, we're not going to focus on those reasons today and those problems today, because there's a lot of treatments that have long existed to deal with these types of problems. Most of what we're going to talk about today is sensory neural hearing loss, and that involves problems primarily with the cochlea, or the inner ear, and some of these hair cells that exist within the inner ear. Aging is an extremely common cause of some of this hearing loss. Genetics are. It's very common that if your parents had hearing loss, then you might be more likely to have hearing loss than someone whose parents didn't. Certainly you could be born with hearing loss, but you could be more predisposed to losing it along the way. If you're someone who's had a lot of noise exposure, be it from military experience, from loud music, from your occupation of being around loud noises without ear protection, for example. Sometimes certain medications can cause problems with hearing loss. Some people who undergo chemotherapy, the actual chemotherapy agent can destroy some of your hearing. Meniere's disease is something you may have heard about. It is often associated with some degree of dizziness, but it can also have a problem with hearing. a more unusual situation, someone could wake up deaf one day. All of a sudden their cochlea stopped working, and a lot of times we don't know why that happens. It can be a very strange and rare virus that does it, but certainly every month in our clinic we see people who suddenly have gone deaf. There can be various tumors that primarily sit on that nerve. It's actually the balance nerve that sits next to the hearing nerve, and it pinches off the hearing nerve, and that also is a cause for some degree of hearing loss. So those are a lot of the different things that I'm going to focus more on today, the treating of a sensory neural hearing loss. So to measure hearing, you undergo testing by an audiologist, and typically that's performed in a soundproof booth. And ultimately the audiologist is going to develop a specialized graph called an audiogram of how you're hearing. And so this is two examples of the same thing essentially. But on this particular graph, you have two axes. You have this x-axis, or the one that's in the more horizontal plane, and that shows the various frequencies or pitches of sound from the low to the high. So, and we care most about the mid frequencies, this particular area here, because if you look over on this graph here, that's where most of the sounds of human speech are. You know, dogs can hear sounds that we can't because we may not be able to hear all the high frequencies, but we don't really need to hear what dogs hear. We need to hear what humans hear, and that's primarily speech and voices. Now, on this axis here, the vertical axis or the y-axis, this is the loudness that it takes for you to hear the given frequency. So ideally, you want to be as high up on this axis as possible, and anything 20 decibels or closer to the top is considered normal hearing, at least for a young person. As you drop lower and lower down the axis, your level of hearing diminishes. And so as you get a hearing test, each of the various frequencies along the way are tested. So it's not to say that if you have hearing loss, it's going to be all bad or all good. You might have some frequencies you hear quite well. For example, the low frequencies are often preserved when you have age-related hearing loss. But the graphs that are obtained from this are really helpful. When you have a mild hearing loss, it's sort of similar to if you remember when you were younger and you got a cold or allergies or something and your ear just felt blocked up or plugged just from that kind of cold, an annoying sort of muffled nature of the hearing. You could still hear everyone, you weren't deaf, but it just wasn't quite as good as normal. And that's along the lines of what a mild hearing loss is. As you go further down, a moderate hearing loss is more significant. It's almost like you take your fingers and you plug off your ears like this. So, you know, if you're hearing something really loud, like you're at a concert and it's just much too loud, or if you're hearing a jet engine, you'll put your fingers here to block a lot of those sounds. It's not to say that you can't hear that there's a concert going on or a jet engine playing. You can hear loud noises, but you're not hearing things as clearly when they're at a normal conversational level, and it's particularly bad when there's background noise that's confusing everything. As you get lower and lower down this graph, things are getting worse and worse, and you may not understand anything but very loud speech immediately next to your ear. And more you rely on other cues for hearing, like people's lips moving, for example. When it comes all the way down to the bottom of the graph, this profound hearing loss, you can be stone cold deaf, where you don't even hear the jet engine. So this graph kind of shows the various sounds of how loud certain things are. You really need to hear at least in the mild to moderate range of level of hearing, because, actually let me rephrase that. You want to hear as high as possible because you're able to hear anything below where your graph is, but not above. And so if your hearing is in this moderate range, if you look here, all of these various speech sounds are not able to be heard. There's something called a speech banana. It's a little term, that's a medical term, and that's where a lot of these various sounds are. So if your hearing is lower than where this banana is, you're missing those speech sounds at regular levels. And so hearing test gives us a lot of information. Now that's part of where it shows you. It tells you where the tones are heard. It doesn't tell you how you understand things. And with a hearing test, they also will measure if you actually understand the words that are being told to you. So I have this little animation. You may have seen it before. It's from something very familiar to a lot of people. And it kind of goes through a little bit of how one is hearing with various levels of hearing loss. So I'm not sure that the volume is loud enough. If it's not, we're going to play it again. We might play it twice anyways. But this will give you an idea of what hearing loss levels mean.
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game.
Put the busted. That's 1 down and 2 to go. Betty, it's your turn.
I don't have any more money either. You got it all.
Then I'll take a mortgage on your open home. Well, come on, take the dice, will you? Don't just sit there like a dummy.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
So that might have been very difficult for many of you to hear, but if you had normal hearing, it would give you a pretty good idea. I'm going to kind of go through it one more time, and I'm going to talk as we go.
5, 6, 7.
This hearing graph is entirely normal above that 20 line that we were talking about, and the voices sound clear. Everything sounds great. When you start getting a mild hearing loss, and this is only at the high frequencies, it's just a little more muffled. You can still understand it, but you have to kind of think just a little harder. When it's moderate, you can really imagine yourself pushing off your ears and things sounding more muffled. Again, by using cues like watching their lips, which can be a little difficult for a cartoon, it can be, more easy to understand. And with severe, it's very difficult to know what's going on without other types of cues to orient you to what's being said. So briefly, I wanted to talk about age-related hearing loss. It's common. It's actually more common to have hearing loss than not to have hearing loss once you get to a certain age. 50% of individuals aged 65 or older have some degree of age-related hearing loss, and 80% of those aged 85 or older have hearing loss. That's a tremendous number of people who have hearing loss and that are missing various sounds out there in the environment and in their lives. Certain things can predispose to more age-related hearing loss or can worsen or hasten the hearing loss. We talked a little bit before about genetics. It can run in your family, but even health choices like smoking can cause that because it can affect some of the blood vessels that supply your hearing nerve in your inner ear. Noise exposure, we mentioned, certainly can hasten age-related hearing loss. Having heart trouble, high blood pressure, diabetes, kidneys trouble, and other types of inflammation in your body all can contribute too. So it's sort of a double whammy. If you're having health problems in other parts of your life, unfortunately, you're more predisposed to hearing loss. So it's not fair, but it's something to be aware of. When you have a higher frequency hearing loss, it can be more difficult to understand consonant sounds and people who have accents. So especially on the phone, when you don't have cues like people's lips moving and watching how their hands are moving and kind of what they're describing, it can be very difficult to understand someone who speaks with a different accent more so than someone who doesn't. It's more difficult to hear in noisy places when there's background noise. And it can seem like people are speaking too softly or mumbling. It's a very common occurrence that we'll have, one spouse drag another spouse into our clinic to say, check their hearing, and the person who in question or the person who potentially has the hearing loss will sort of say, it's not me, they're always mumbling. They always talk too softly, and if they would only speak without mumbling, then I'd be able to hear them. And by and large, unfortunately, that's not the case. Yes, there are mumblers out there, but the hearing loss is generally playing the bigger role. We were talking about the higher frequencies being more impacted in the hearing loss, but as the lower and mid frequencies are impacted, that's where that speech banana was, and that becomes more and more difficult to understand the words that are being said, even if they're said loud enough for you to hear them. This kind of shows an example of age-related hearing loss. The medical term for that is presbycusis. And so what you can kind of see is the various ages. You know, a 20-year-old is all in the normal range, and by 40, many people are starting to edge out of that normal range. Now, the scary thing is teenagers today are having increased hearing loss, and that's coming from these MP3 players and the headphones that are very, very loud. It's almost like they're doing military service and they're just sitting in their houses listening to this music. So we know that it's serious, and it's not something that's isolated to older generation. It's actually getting worse. But with that said, as you age, certainly your hearing tends to get worse and worse. That can be accelerated by any of those other things we were talking about, particularly with noise exposure or some of the genetics. So you might be a 50-year-old but have the hearing of a 90-year-old if you have some other risk factors for hearing loss. Now, about 16% of working-aged individuals, so between the ages of, say, 20 and 69, have hearing loss in at least one ear. And that makes a big difference. Even having one ear impacted has been shown to affect a lot of your occupational attainment. And by that I mean you are less likely to earn as much as someone who can hear well from both ears. And actually there's a study that showed the annual wages being less by a factor of about $8,000. So going from an average wage of about $31,000 a year to about $23,500 in a year just from having hearing loss. And why is that? It's because you're going to be looked over potentially more for a raise or a promotion. You're going to feel less comfortable to advocate for yourself to get these types of things. And sometimes you kind of take a step back because you don't want people to recognize that you have this hearing loss. And by hiding it, it doesn't help you get ahead. Now, interestingly, even though the people who have this hearing loss earn less, they are not any more likely to receive SSI. So they're not deriving other kinds of benefits. They're just getting hurt by the hearing loss. So hearing loss is real, and it's real at any age. I'm not mentioning here about children. I actually have a background in pediatric ear, nose, and throat surgery, and there's humongous implications for hearing loss in children. It used to be that you would say, well, if you had one good ear, you're fine as long as you have the one good ear. But that's not true. In school, about a third of kids who have only one good ear fail a grade. That's about 10 times higher than if you had two good ears. So it's not because they're dumb. It's not because, you know, they are a problem person and have health problems. It's because they're missing sounds. And so it affects kids, it affects working age people, it affects older people, and it's a big problem regardless of the age. So what are the health effects of untreated hearing loss in the adult population? It can impair your memory, and it can affect your ability to learn new things. It can be pretty hard to remember something you didn't hear properly in the first place. So that's a huge thing. And if you already have some degree of memory loss, it can actually hasten the decline of your ability to think quickly. It can mimic dementia. Some people who seem to be very forgetful, well, they're just not hearing, and they're actually remembering just fine, but they're just not hearing the different things they're supposed to remember. I think some of you may have been exposed to people who have hearing loss that are very negative or angry or irritable, particularly when you mention some of the shortcomings in their hearing. It can cause you to feel tired, to feel tense, stressed, depressed when you're not hearing as well, largely because it's very socially isolating and it's very lonely not to live inside the world. And the world is a hearing world. And when you're outside of that world, it's very off-putting and it's very isolating. It can make you a little less alert. If you're not hearing things, if you're not exposed to all the normal sounds, you know, it's easy to just kind of go off into your own little world and take a nap. There's actually increased risk of falls. That's a serious thing. Falls lead to hip fractures. Hip fractures lead to serious problems and potentially even death. And that might be because you can't hear when the carpet ends. You know, you don't have some of the cues of when there might be a, you know, you step in a puddle or something like that. And so you're at more risk of falling. And the increased risk of accidents. If you can't hear a car zooming by you on the side, or if you can't hear the turn signals or, you know, someone else shouting from the outside, you potentially are putting yourself at risk or others at risk. And so there's serious implications of not being able to hear from a health and wellness standpoint. I think a lot of spouses of people who have hearing loss recognize that it's not just the person with hearing loss that is affected by the hearing loss. Actually, when you look at the spouse of someone who has hearing loss, there's worse outcomes in their own physical health, psychological health, and social well-being, because while the person with hearing loss is isolated, often the person without hearing loss is stuck being isolated as well. They're not able to socialize in the way that they necessarily were in the past or have become accustomed to and that they want to be. And so they're kind of stuck in this world, and it's even worse when the person who has hearing loss is in some degree of denial and they're just sort of stuck in the middle, the person who's actually able to hear. A very interesting study was done a few years ago between an ear, nose, and throat surgeon, a psychiatrist, and a urologist. And they looked at fairly young men between the age of 20 and 50 who had hearing loss that was acquired. So they previously heard normal, and at some point along the way they developed some degree of hearing loss. And they actually posed questions of all the various sexual health spheres. And in all the domains tested, be it erectile function, orgasmic function, sexual desire, the satisfaction with intercourse, and then overall satisfaction, in every single one of those spheres, the people who had hearing loss fared worse. So there are serious impacts related to hearing loss, and it may not always be in the areas you think. A very short word about tinnitus. Tinnitus is, what people call ringing of the ears. It's an illusion of sound when there's no sound there. And it can sound like any number of things. It may be a ringing noise, it may be a hissing noise or staticky noise. It may sound like buzzing, or you might hear a kind of crickets, a whooshing, a roaring. There's many, many different ways that you might interpret the ringing noise. And it's extremely common. About 45 million Americans have this problem, if not more. And it's extraordinarily commonly associated with hearing loss. So if you have ringing, you need a hearing test. We're not going to talk about all the different treatments for hearing loss in terms of surgery. There are some that have been around for decades. Ear tubes, for example, to clear fluid that if it's sitting in the middle ear. Repairing eardrums if the eardrum's got a hole in it. Repairing hearing bones if they're missing or fused. We're not going to talk about those types of procedures today, nor are we going to talk about implantable hearing aid technology. There are actually some surgeries that you can implant hearing aids onto the hearing bones themselves. And those are not in widespread use right now, and so we're going to avoid those particular topics. But down the road, you might be hearing more and more about different types of surgeries available to you. What we will talk about are two particular types of devices that can be used to manage hearing loss of different kinds. The first being something called bone-anchored hearing aids, and the second one being cochlear implants. So as you just heard, hearing aids, they're the mainstay of treatment for hearing loss, but you need to have a few things for the hearing aids to work. You need to have ear canals for standard hearing aids to work. If you were born without an ear canal, or if you, for some reason, had an ear canal that scarred off or was so small that you couldn't get the tube from the hearing aid in there, it wouldn't work. If you have ears that are constantly draining because you have infections or because they're allergic to whatever the hearing aid is made of, or for whatever reason, then you can't put a hearing aid in there because it'll constantly get mucked up and it just won't work for you. And if you can't understand the words, it doesn't really matter how loud it is. You're not going to be able to wear those hearing aids if your understanding is extremely poor. So what I like to do is think about hearing as an old school radio with two dials. You've got your volume and you've got your tuning. When you think about hearing hearing loss, what hearing aids are able to give you is amplification, is moving that volume dial so that if you're on, for the most part, the correct station, be it music or NPR or whatever, if you're on that station and you turn the volume up, well then that's wonderful. Then you're hearing a little bit better if the volume was too low. But if you're not quite on that station, you're a little bit on static, just a little bit off, turning the volume up might help you identify what sound it is or what the people are saying, but there's still some annoying issues in the background. And if you're more on the static than on the station, it doesn't matter how loud you turn it up. You won't know what song's playing. You won't know what they're saying. It's not going to be very useful to you. So there are limitations to what the hearing aids can give you, even though they're so much better than they used to be. So hearing aids don't work for everyone. And so some of what we're going to talk about today are alternatives when hearing aids are just not an option. A special situation is single-sided deafness. So when only one of your ears is hearing, it's a problem. Two ears are certainly better than one. When you have two hearing ears, your ability to understand speech in a noisy background is much better. And say you're at a dinner party or such, and you have conversations going on either side of you. If you only have one good ear, you're going to have to really turn your body, or you're going to have to miss out on conversations because you need those two ears to tell you what's going on. Also, two ears allow you to understand which direction sound's coming from, which can be a safety issue. There are some options that don't require surgery in this situation. There's a certain kind of device called a cross hearing aid, which say if you had one great ear and one ear that's totally deaf, you would actually be able to put a hearing aid-like device in both of the ears and say it was your right ear that wasn't hearing so well. The hearing aid on the right side isn't really an aid at all. It sort of is a microphone and a transmitter, and it takes that sound that was coming into this ear and it transmits it over to the hearing aid on the other side, which is more of a receiver, and it is then going to allow any conversation taking place on your bad side to be heard on your good side. And that's nice, but when you have a good ear, it's not very enticing to wear something in that one good ear that you have. Now, if someone's talking on this side, it's not like that's a hearing aid and it's going to make everything sound too loud. You're going to hear everything normally on the side that you have a normal ear. But wearing two hearing aids when really you only needed one ear helped can be troublesome to some people and annoying. This kind of technology can also be used if you have one terrible ear and one not so great ear, where there actually is a hearing aid on your not so great side, and the sound can go over that way as well. But that's just an aside. So bone-anchored hearing aids are an option that can manage a number of the problems we talked about on the other page. It can handle some of the single-sided deafness problem. It can handle when you don't have an ear canal, or you have a draining ear, or for any other reason why you have hearing, you have understanding, you're mostly on the correct radio station, but you're not able to wear the typical hearing aid. This borrows from the technology, the dental implant technology. You know, a lot of people who have dentures use an adhesive to secure the dentures into the mouth, but some may have a particular implant that can click the denture right on, or you might have a tooth that's been implanted into the jaw, and that's fixed there, and when that's fixed, it's not going anywhere. It's as good as your normal tooth was, essentially. Using that similar technology, a small, essentially almost like a screw, but it's a small implant, can be placed into the skull bone itself, and it can integrate in there. And onto that, you can sit a hearing aid. And what that does is it actually vibrates the bone. It's not something you feel, your head doesn't bobble around or anything like that. You wouldn't know, and no one who touched you would know that it's vibrating. But the sound actually vibrates the skull. It bypasses the outer ear, bypasses the middle ear, and it directly stimulates that inner ear, so you can hear again. And I actually have a demo of that, so if anybody is interested, I can show you what it feels like if you have one bad ear to use this, this system, or anybody could try it today, it's fine. This is very interesting, but there have been some limitations in the past that now are partially overcome. One of the limitations is you can kind of sort of see, this is a person who's sort of been cut straight down like this. And this is that titanium implant that's sitting in the skull bone, and this is the hearing aid. It's sort of about the size of a matchbox that sits on there. But this screw is sticking out of your head. So a lot of people say, well, I don't want to look like Frankenstein. Now, it's not sticking very far out of the head. It doesn't look particularly strange, but there is some care involved when there is this device. You almost have to treat it like teeth. You know, you have to kind of brush it to make sure the skin doesn't grow over it, and you have to just, you know, take care of it. And so that's been a limitation in the past, and I'm going to show you how that sort of changed a little bit. So I want to just show you how this device kind of works. So sound comes in from the outside, goes to the hearing aid, and that hearing aid then sends it to this implant, which vibrates the bone, bypasses the middle ear, and that sound then goes to the inner ear, to the cochlea, and then to the brain. So this technology can be used to treat single-sided deafness. And so in this particular example, you have the implant on this side. So this ear is the deaf ear. So if a person typically, without the implant there, is talking on this side, unless the person turns themselves around so that this ear is hearing it, or unless the person on this side is talking loud enough, it's going to be difficult to really understand everything that's being said. Well, if you have this implant in here, then this microphone can collect the sound, transmit the vibrations through the skull, and it actually goes to the other ear as well. So it doesn't matter that this ear, the bad ear, can't hear. The sound will actually go to your good ear. And so that can be extremely useful for treating this particular kind of deafness. Now, I had mentioned this particular device required a screw that was visible on the outside, and that's been a limitation for us in the past. But newer technology has been approved in the last year, year and a half, that actually allows underneath the skin where the implant is placed to be covered by a magnet. And then the skin gets closed up over it, so you'd never know anything was there. And then your hearing aid, this is kind of the newest look, it just came out in the last month or so, no longer kind of looks like that square box, but that hearing aid goes onto a little magnet itself, and then the magnet connects to your head, and that's it. Now, it doesn't look as funny as you think, and this is kind of a color that's a little bit more obvious, but they make them in most of the various hair colors, and that is an alternative to having to take care of the abutment, the device on the external part of the device, and it becomes a lot less obvious and quite easy to use, and you can use it throughout the day, and usually just take it off to shower. Now, how does this look in reality? So this is sort of how it looks. That's how that screw sort of looks. It sits quite close to your skin level. It's not really poking out of your head at all. And in the past, if you were to look up on the internet, you know, what is this bone-anchored hearing aid about, you're going to see a person who has a big bald patch, even if they have tons of hair, that sits around the device. And it used to be, even 5-10 years ago, that we'd actually have to physically remove each of the hair follicles so that the skin could sit as close to the bone as possible so that the hearing aid would work, the bone-anchored hearing aid would work. But now that's not necessary anymore. So we thin it some, but the hair stays present. So what you see is this female is actually wearing the bone-anchored hearing aid here, and you can barely see it because it's hiding underneath her hair, and it still works just fine. This gentleman here has one of the magnetic kinds, and so you can't even see anything wrong behind his head, and now he's got the hearing aid on. This is a different company's device, but it's the same idea, and so again, you see this abutment that's visualized. You see some of the hair has been removed here, and again, it tends not to be necessary to do that these days. So what exactly is involved in the surgery? It sounds pretty scary, drilling into the skull. What's that all about? It's actually quite easy. It's an outpatient procedure. It takes generally under an hour. You really don't shave all that much hair at all. Essentially, you just need to have a thick enough skull. So any adult is pretty much a pretty reasonable candidate for this. If it's a child, there's actually a special elastic that's used until they're about 6 years old because their skull's not thick enough till then. But a grown-up, you don't have to really worry about that. And you essentially place the implant in a similar way to a dentist placing a dental implant in your jawbone. And you just let it heal for about a month, and then boom, you wait a month, and then you can start using it. There's really not a whole lot of learning time to it. You put it on, and it's it tends to work. Now, there's some of the same kind of ideas of a hearing aid. You might need to make adjustments, but you don't really have to learn to use it in some of the ways that you might with other kinds of technology. It's quite safe. There are some risks. They're not very high. You can have a little bleeding. There can be infection. It could be much like a dental implant. If theoretically it got infected or loose or something, there might need to be some further work done with that. But by and large, it's actually not something that has a lot of complications associated. Now, if you chose the one that had the magnet instead of the external abutment screw, magnets are a part of getting an MRI. It's a magnetic resonance imaging. So if you're someone who needs to get MRIs, you generally don't want to wear a magnet, so you have to kind of get a less strong MRI these days if you have that magnet. So if you needed lots of MRIs, that might be a bit of a problem, but most people don't need lots of MRIs. And if your hearing is really, if you want the best possible hearing, you do get a little extra gain by having the abutment that's visual on the outside. But a lot of people want to start with the magnet, and you can convert with a separate procedure and take the magnet off and put the screw if you really have to in the future. Now, this technology is only good if your hearing is decent. And by that I mean only half bad. You have to have understanding, or you're just going to be doing the same thing like a regular hearing aid. You're just going to be amplifying the sound but not clarifying things. So it's not for everybody, but this is one option out there. Okay, cochlear implants. A cochlear implant is a device that's implanted also into the skull, but this one's a little different because it also goes into your inner ear itself. It gets implanted into your cochlea, and this allows stimulation of the hearing nerve directly. This is the one that lets you change your tuning dial to get back on the radio station that you need to. This is pretty much one of our only options we have available right now to clarify sound. And it's quite expensive technology, and actually most insurances will cover it for the appropriate candidate. But you need to, at this point in time, have hearing loss in both ears that's severe enough that hearing aids are not working for you. And so there's certain tests that we do to see just how bad the hearing is, and it has to be pretty darn bad for you to qualify. But we actually have hundreds of thousands of people in the Bay Area that could qualify for this technology, but that don't, have never tried or considered it. So even though the hearing has to be pretty terrible, there's a lot of people out there with pretty terrible hearing. Now, this device does not restore normal hearing. It may tune you. You may be able to tell what radio station it is. It is not bringing you back to the hearing aid you had when you were 14 years old. But it can give you back your ability to socialize, your ability to talk on the phone, your ability to get out there again. And this is really life-changing for a lot of people. It is not the easiest thing in that you really do need to retrain the brain afterwards to understand what these new sounds are that you're hearing. People can complain after they get this type of device that voices sound like Donald Duck or they sound like robots. It's not exactly like it once was, but it's remarkable that if you give it some time and you practice with it and you relearn how to hear, you can start getting a lot closer back to the sounds that you remembered what were normal sounds. So how does this work? Well, for a cochlear implant, there's an outside portion and there's an inside portion. So I'm going to kind of show you here how that is. There is an external portion here that almost looks like a hearing aid, but nothing goes into your ear canal for the standard cochlear implants, where again you have the microphone that's going to pick up sound. That sound is then going to be processed here in the speech processor and converted to a pulse that is going to go through this particular coil. So this is another thing with a magnet. The magnet on the outside is going to communicate with this magnet on the inside for the receiver stimulator. And it goes almost by a radio wave through your skull. You don't feel any of it. That then gets converted to electrical pulses that go down, down, down through this wire, and these electrodes go to your cochlea. So we kind of mentioned before how some of the lower pitched voices or lower pitched sounds are here, and the medium ones are here, and the high sounds are here. It can selectively send sounds to the frequency that you need it to, and then that goes onto the brain. Stimulates the nerve and goes onto the brain. Most of the time when you have hearing loss, the problem is in the cochlea itself. The hearing nerve is okay. So if you can overcome the problem in the cochlea by stimulating the nerve directly right there, things can be a lot better. So I'm going to show you an animation here. So you're going to see again this external device where you have the outside processor, the microphone kind of sits here, and sound's going to come into this microphone. It's going to go through, and then this is an electrode that's going into your inner ear, okay, into the cochlea. It kind of circles around. The initial ones only had one single electrode. It was only stimulating one single frequency, and the ones now are upwards of 20. So this is showing the sounds kind of going in and stimulating the various points, the various electrodes, and it might be, you know, multiple at the same time, but through this and through the various parts of your cochlea being stimulated, the sound goes down your hearing nerve to your brain, and then your brain interprets it as sound again. A lot of people have a hard time understanding what this kind of means, and so I'm going to give you an analogy that's completely different, but just to kind of put it in perspective. If you imagine a person who's entirely blind, where the world is black, okay? Say in the past you looked in the sky and you saw a rainbow, the beautiful colors, red, orange, yellow, green, blue, you know, etc. All the, you know, and all the colors in between, it just all bleeds into each other. If you go from looking at a totally black sky to seeing, not perfect, but seeing a red line, an orange line, a yellow line, a green line, a blue line, you look up and you say, well, that's a rainbow, and it's actually pretty beautiful compared to seeing black. Now, it's not that beautiful, rich rainbow that you saw before, but you know it's a rainbow. You look over there, oh, that's a rainbow. It changes your life to know that that's there. It's kind of similar like that with the cochlear implant, although it's getting better and better. So, what can a cochlear implant do for you? The hearing benefit can be variable, and it sort of depends a little bit on how much effort you put into it and how long your hearing has been not good. Generally, people get at least some benefit, but it can be amazing. It can be near normal. An example would be children. So the FDA allows you to implant children as young as 12 months, and even some 4 or 5-month-olds have been implanted for other reasons. But these are children who would otherwise be completely deaf and basically limited to sign language for communication. And if you implant them at that really young age as the brain is developing, by kindergarten, you would never know that most of these kids had a single problem. They have normal speech in most cases. They run around in the playground. You call them from the other room. They hear you. It's amazing. And so that's the potential of how good it could potentially be for an older person who's had hearing loss and then it's restored. But as Dr. Smith was mentioning, the longer the hearing's been out, potentially the results may not be as good. You just don't know for sure. I can tell you that we have a patient, the first patient that we implanted here is 93, and this patient immediately heard better from the second that it was turned on. So age doesn't limit things. You just don't know, but by and large, people do better. It just takes a little bit of time. It allows you, these implants, to perceive different sounds, soft sounds, loud sounds, the sound of someone burping, of a turn signal, of music, of someone clapping, of you name it. All the sounds in the environment that you may be having a hard time hearing, it does let you hear. It lets you understand speech without having to lip read, or at least very much allows you to have improved lip reading. In most cases, you can actually speak on the phone again, which is humongous when people who have been unable to speak on the phone for years suddenly get that back. It can let you watch television easier. In some cases, even enjoy music. That's kind of a newer thing. In the past, the cochlear implants were not good enough that you could enjoy music, and music would sound very, very strange. But it's getting better and better, the technology that's out there. A lot of people who have severe deafness, their speech is not quite normal. You might have heard just kind of, it sounds more garbled, or it might sound too loud. It can help to modulate your own voice and significantly improve quality of life. A very brief side note is that there's now something that's been approved called hybrid implants. We were kind of showing you before that age-related hearing loss is often at those very high frequencies with some normal lower frequencies. What some of the newer implants actually do is they preserve your lower frequencies, and you only have the higher frequencies amplified with the implant. So you have a joint hearing aid / cochlear implant to hear naturally the sounds that you still can hear, and then the implant for the ones that you can't. So how do these look? Well, again, you have the external device, and you see here Rush Limbaugh, he has bilateral, he has both-sided cochlear implants and is able to talk on his radio show. And so, you know, it can be really get you your life back. A lot of times people choose them to match their own hair color, but you don't need to have hair to wear one. And some people like to have them with flair, and you can even have lighted ones and sparkly ones, and you name it. It's sort of your choice. There's a huge number of fashion options out there. What is the surgery involved? Well, usually you can go home the same day, although sometimes you can get a little dizzy with surgery. So some of our older patients, we will observe them in the hospital overnight just to make sure everything is okay. There's minimal hair that's shaved. There is a cut behind the bone, or behind the ear. The bone is drilled behind the ear, in the skull to some degree, and in the inner ear. However, it's not something that anybody would ever know. You don't have a chunk out of your head. You look totally normal. Once everything is closed up again, it's all on the inside. You look just the same on the outside. After the implant is placed, before you even wake up from surgery, we actually will do an x-ray, and we'll actually verify that the device is working properly. So you don't even have to be awake for us to know that it works properly. And then after healing for about a month, then we activate, we basically turn the device on or reactivate it, and then you start the learning process of retraining your brain on how to hear. And that process takes kind of weeks to months in general. So the risks. This is a little bit more involved. There are risks. They seem extremely scary, but they're very uncommon. Risks of anesthetic are a significant concern. So if you have other health problems, say with your heart or your lungs or diabetes or what have you, we do require medical clearance from your physician and potentially cardiologist. There are some risks of bleeding, infection, dizziness. The nerve that moves the face sits very close to where we're operating, as is a nerve that controls some of the taste of your mouth. So we're very careful to preserve these nerves, and it's not something by and large that's a huge risk, but it is in the vicinity, so it's something we take seriously. You can have some numbness of the ear just from the cut that tends to resolve. Ear ringing, we talked a little bit before about that tinnitus. Well, actually sometimes in Europe, these cochlear implants are used to treat ringing of the ears. We don't do it in that case here, but a lot of times some of the ringing can be improved from the procedure, but it can potentially be worse. The spinal fluid can leak. That could lead to meningitis. You do have to receive a vaccination beforehand to help prevent the risk of meningitis. It's it's something called Prevnar. It's got the pneumococcal vaccination, and so these are things that are very easy to get through your primary doctor. They do them all the time for us. There's a very low chance, like 1% to 2%, that the device stops working. You know, it is a mechanical device, and if that were the case, then it could potentially have to be replaced, but that's not something that's common. And because of the magnet that sits under the skin, there's also a potential issue with MRIs. You can get CAT scans, but MRIs are a problem. So also in that packet of information, there's a second questionnaire on the backside. And we don't have to necessarily go through all these questions, but essentially, when you're wondering, am I a candidate for a cochlear implant? What you have to ask yourself is, do you have good hearing aids, really good hearing aids, and in spite of those, are you still not understanding what people are saying? Do you have to keep asking people to repeat themselves in one-on-one conversation? Do you have to use closed captioning just to understand television? Are you avoiding social activities because you don't know what's being said or you're afraid you're not going to answer properly? Do you depend on lip reading? Are you exhausted at the end of the day just because communicating takes such a toll on you? Is it hard to keep up at work? Do you have a hard time hearing on the phone? Are you avoiding using the phone? Are you no longer interested in music? Are people around you really wondering what's going on with your hearing? A couple things just on the side, and there's a little handout as well in there that talks a little bit about hearing better. If you have hearing loss, you need to, at a very minimum, put yourself in a position to hear better, okay? Everything else aside. Get those hearing aids and use whatever other assistive technology that you can find, for example, that make the phone easier to use or the television easier to use. Get closer. When someone's talking to you, that's not the time to walk away. You want to get right up in them and be able to see their face. Don't try to listen from another room. You're just not going to be able to hear if your hearing's that bad. You need to take breaks sometimes because it can be tiring to listen so attentively. Ask the person who's speaking to slow down. If they're speaking too quickly, it's just not going to make it very easy for you to know what's going on. Ask the speaker to turn so that you're able to see their face and their lips. And don't pretend that you're understanding. Smiling and nodding is not the way to kind of live your life when you don't know what's going on. And on the flip side, if you're someone who lives with a person with hearing loss, you want to speak clearly. You want to speak in a normal tone of voice. You don't want to shout. Shouting is not helpful. Imagine if you only speak one language, say English, and you go on a trip to China. You know a few basic words here and there in Chinese, maybe enough to slightly get around. But if you go and you ask a question to someone in China that doesn't speak any English, and they answer really quick, or they're not looking at you, and you didn't quite catch that, if they repeat to you by screaming at you louder, faster, that's not really helpful. You just need them to slow down, and then you'll be able to figure it out. Well, in the same way, don't shout at someone who's not hearing. That's not going to make it better. It's going to make it worse. If you want to talk to your significant other who has hearing loss, get their attention before speaking so that they can watch you talking. They can get clues to know what you're saying. Try to talk in quieter places. Try to keep your hands away from your mouth so that the people are able to understand what you're trying to tell them. And take breaks because, again, it can be very tiring for patients to work at hearing all day. These are a few sources that you might want to look at with good information out there. Information from the American Academy of Otolaryngology Head and Neck Surgery, from the American Speech Language Hearing Association, and the National Institutes of Health. There's a lot of questions that you might have about hearing or some of the things that we talked about today, and you can find a whole host of information there. So I just wanted to show you this last picture. This is my son. He was a day old. He was getting his hearing screening. It's never too early or too late to get a hearing test. So certainly I would encourage you, if you have concerns about your hearing that have not been addressed, to go ahead and talk to your doctor and work towards getting those answers to any questions you have.